Good evening, everyone. It's Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. So a webinar where we're going to discuss Lyme disease and related conditions like mold toxicity, for instance. For those of you that are here again, welcome back. I see a number of familiar names on my message board, and I also see a lot of new names tonight too. So those are new people. And so to you new people, I'm glad you're here as well too. I hope you're going to gain some information here tonight and some knowledge that will help you with your treatment and help you understand this thing we call Lyme disease and related infections too. So the way you participate is two ways. Number one, you can listen to the questions and read the questions when I post them. You only get to see them in the live version though, but in the recorded version, you have to listen to me read the question and then see what responses I give, and that there can be some good information you'll learn that way. The other way to participate is to write a question to me, and the way you do that is on the bottom side of your screen on the right-hand side. There is a chat box. Write your question to me through there. The only thing I ask is that you don't hit enter multiple times as you're writing that question. Actually hit the enter key only when your full question is complete. If you hit the enter key before then, it actually sends multiple questions my way, and it gets hard to manage from my side. I am creating a recording of the webinar tonight, and if everything goes as planned, I will do an edit on that late tonight and then do a synopsis for it and send an email to you in the morning announcing when it's ready to be viewed. In that email will be a link so that you can sign up for the next webinar, and that next webinar is next week. And then after next week, I will be off for a week before we begin them again. So we have tonight and next week, and then the next set of webinars will begin in October, actually. Wow, where does time go, huh? All right. So without any further ado, I'm going to go ahead and post the first question here. Hello, Frank. Let's see. Dr. Ross, my wife is 6 weeks into your herbal protocol for BART. I have been giving her the glutathione, quercetin, and curcumin as well to manage her cytokines. Starting at about day 10, she began experiencing an increase in existing symptoms and a return of some that she hadn't experienced in years. I take this as a good sign that the treatment was working. These increased symptoms were manageable, so we continued, but as of last week, the symptoms got very bad. Extra glutathione hasn't helped. At what point do you consider reducing your herbal treatments, and if so, by how much? I don't want to discontinue completely for fear of having the bark grow back and starting over from scratch. Thanks for your help. All right. So everyone, when you start treating Lyme, or you start treating Bartonella, or you start treating yeast, actually, intestinal yeast overgrowth, as we kill the germs, we can trigger something called a Herxheimer reaction, okay? And that's what this sounds like. So let me talk about what that is and how that relates to the original symptoms that your wife had as well too. So when you have Lyme or tick-borne infections or too many yeast in your intestines, the immune system tries to get rid of those infections. And some of the white blood cells in the immune system will see these germs and will then want to warn the rest of the immune system that they're there. All right, so they make these chemicals called cytokines. Now, cytokines are good and bad. In the right amount, cytokines are designed to actually turn on the immune system. So these white blood cells that see the problem send out these cytokines, and those cytokines recruit more white blood cells to where the infection is. They help those white blood cells work better, and they even cause more white blood cells to be made to fight the infection. So that's all good stuff. However, in Lyme, in yeast, and in Bartonella, sometimes the immune system doesn't do a good job. And it keeps trying harder and harder. And to do so, it makes more cytokines. But eventually, those cytokines become a problem. And so those cytokines in excess give you all of the symptoms that we call Lyme or Bartonella or yeast symptoms, okay? So excess cytokine symptoms give you fatigue, insomnia, brain dysfunction, can give you some neuropathies, interfere with how your hormonal systems work. Essentially, when you have Lyme or Bartonella or yeast symptoms, they are excess cytokine symptoms, all right? Now, when you start killing germs, when you reach a level with your tinctures that you start doing good germ killing, the immune system is going to respond by seeing all those dead bug parts, and it's going to make more cytokines, right? So what it looks like is you're worsening, or some of the original symptoms that you had come, or that your wife had, or any person had, come back again. All right. So this is a Herxheimer reaction. It is a situation of excess cytokines. Now, it's okay to have some degree of a Herx reaction, but when it starts getting severe, it's not okay. And that is, sometimes these excess cytokines can create more ongoing injury and cause significant setbacks. I think what you described when she first started having the worsening, that was an acceptable level. Where she is now, where she's really getting more severe symptoms, I think is probably not an acceptable level. So usually what I would do in situations, so the way you manage it is partly what you're doing, which is you want to take things to lower these cytokines. One of those things is curcumin. Another is quercetin. Those two both essentially do the same thing. They get inside of white blood cells and they cause them to not make as many cytokines, okay? So a good dose for curcumin to help prevent Herxheimer reaction and to manage it is 500 milligrams 3 times a day. Sometimes I will go up to 1,000 milligrams 3 times a day. And the dosing for quercetin is 500 milligrams 3 times a day. In addition, you can do glutathione, which works by blocking the messengers that tell the white blood cells to make cytokines. And you could take it as 1 teaspoon twice a day. That's usually about 400 to 500 milligrams twice a day. The product I'd like for that is a product made by a company called Research Nutritionals. And they have a liposomal product that gets really well absorbed. Liposomal means that the glutathione is microscopically wrapped in fat to increase its absorption. And it's probably one of the better products that I have out there for that. Okay. But if you're doing all that and things still are getting worse, then it's time to pull back on the treatment. Not stop it, but pull back. Okay. So generally what I'll do when somebody gets severe is I'll have them go back to the level of the tinctures they were tolerating before they got severe. All right. So you'll have to look back and see. So I didn't say before there was any Herx reaction, but before you started having a severe Herx, I would drop back to that level. That's what I have my patients do. And then as soon as the Herx lifts, it would be time to start resuming them again. But when you go up on them, and this is one of the things I do describe in my protocol too, is as you're increasing the tinctures, you want to be careful that you don't trigger Herx. And so if you start Herxing, it's time to stop increasing, not stop the medications, but stop increasing, wait for the Herxing to lift, and then go ahead and increase it again. All right. So you can use your Herx as your guide as to when you increase it. Now, sometimes people really get hung up on the idea of trying to reach that 30 drops twice a day that I talk about with some of these tinctures. And the thing is, that's great if you can, but not everyone can. What you're really looking for is a dose that's going to bring you forward, okay? And so sometimes maybe people can only tolerate 15 drops twice a day. The 30 drops twice a day on these is a goal. And I think on the cytokine, I think I have it listed so that you go up to half a teaspoonful 3 times a day. If you can only reach a quarter teaspoonful 3 times a day, that's adequate. You can do that, okay? What you're looking for is just a dose that's going to do enough killing to move you forward, okay? All right. So Frank, there's no hard set rule about what is too much of a Herx, but what I can tell you is if you're really starting to be taken down in a bad way, not just more minor achiness, more minor increases in fatigue, but severe fatigue, severe achiness, I have seen people get marked setbacks that take them a long time to recover from when you get that way. So I try to avoid those kind of severe Herx reactions for that reason. Okay. All right. Good luck to you, Frank. All right, so everyone, I'm just going to do a quick screen share here and show you an article that you can look at for more information here. Okay, so this is my Lyme disease information site. And take a look at the online Lyme guide here, and then look at my section called Herxheimer and cytokines. And you could take a look at either one of these articles, this article called Herxheimer die-off reaction, inflammation run amok, or my article on cytokines, okay? Either one of them basically cover the same information, but this is about how do you manage Herxheimer reactions and why do they happen? Okay. All right. All right. Good luck to you, Frank. Good luck to your wife. Hello, Jake. Let's see. Hi, Dr. Ross. Your webinars are amazing, and I must say that your extensive knowledge on a wide range of topics is quite impressive. Thank you. I appreciate that. I've spent a lot of time and many years, as many of you know, learning all this stuff. So thank you for acknowledging that. I appreciate that. Let's see here. I have Lyme, Bart, Babesia, and have a strange issue. I feel great when the air temperature is 77 or above. However, when the temperature drops to 70 or below, there is a huge difference in how I feel. At cooler temperatures, my legs can get weak and my feet get very cold and can even go numb. I have been told by some doctors that it could be Raynaud's syndrome, but I do not think that is the case. Another doctor told me that it is possible that it is cryoglobulinemia, which is when abnormal blood proteins called cryoglobulins clump together at cold temperatures, restricting blood flow and causing damage to skin, muscles, nerves, organs, especially the kidneys. Have you ever heard of cryoglobulinemia? Have you had any Lyme patients with similar issues with cold temperatures? Also, do you have any advice on how to improve this issue? So I do think that both conditions that you have mentioned here are possibilities with you. One being the cryoglobulinemia, and the other one being Raynaud's phenomenon. But in a true Raynaud's phenomenon, what happens is due to inflammation setting you up, an infection setting up that inflammation, blood vessels can go into spasm, blocking blood flow, usually into the digits or sometimes your lips, sometimes your fingers, sometimes your toes, and things will go white and they'll become painful, or they'll go blue and become painful. Okay, that's a true Raynaud's phenomenon, right? But you're describing something different, which is you start feeling more achy and worse, which to me suggests something temperature-wise is limiting blood flow. And cryoglobulinemia could be a possibility for that too. Either way, a natural way that you could try to see if it makes a difference for you would be to try to break up these cryoglobulin blocks of chemicals that come together, or to help decrease the stickiness of your red blood cells. Okay, so there's two things you might want to try, and just see if it makes a difference. Give it a 1 month try and see if it makes a difference. One would be to get on the enzyme called lumbrokinase. Lumbrokinase is an enzyme that can break down proteins, usually more blood clotting proteins, but when you get chronic infection, there's an excess amount of blood clotting proteins that thicken up the blood and cause it to not flow into your tissues as much. So that's actually a third thing that could be happening here. You might have some microscopic thickening of the blood due to an overproduction of the fibrin blood clotting protein, which could be involved also in some of these cryoglobulinemia clumps in a way too. So you can try to break down the fibrin that is thickening your blood and maybe is part of these cryoglobulinemia clumps. And the way you use that lumbrokinase, it's a group of enzymes that come from earthworms. It comes either as a 16 milligram pill if it's made by Allergy Research, or if it's made by a company called Candida RNA as a product called Baluki, it's a 20 milligram pill. They're both just as effective. Okay, I use them interchangeably. In fact, I use more of the Allergy Research because it's cheaper than the Candida RNA product is. But you want to take 20 milligrams, 16 to 20 milligrams, one time a day. Try that for about 7 days. If it's not making any difference, then I would increase it to twice a day. Now, the difficulty with lumbrokinase is that it has timing issues because it's an enzyme. If you take it with food, supplements, medicines, it's going to try to digest them. And it won't be then available to actually deal with your cryoglobulin fibrin clumps, if you will. Okay. So you want to take it on an empty stomach by 1 hour either side. You can have water though. And what I mean by 1 hour either side is stop all your medicine, supplements, etc. 1 hour before you take your lumbar kinase, and then you can resume them 1 hour after you take your lumbar kinase. Okay, that's what I mean by that. All right, and then in terms of Raynaud's, if there is a Raynaud's component, what can sometimes help with that from a supplement standpoint is to take ginkgo biloba. Ginkgo helps make your blood a little less thick, and also helps your red blood cells be more flexible to flow more deeply into the deep tissues. A dose on ginkgo biloba would be 60 to 80 milligrams, depending on the product, 60 to 80, up to 80 milligrams twice a day. And that's a 1 pill twice a day on that too. Okay. And try it, see if it makes a difference. Okay. Now, I don't think this is behaving like classic Raynaud's, but there may be a component of it in there. Okay. Beyond that, I don't have any other thoughts as to why this is happening with you. Okay. All right. Good luck to you, Jay. Hello, Duke. Hi, Dr. Ross. I've tested positive through for a Lyme, Bartonella, and Babesia. I have noticed that if I do big workout with weightlifting, I will sometimes get a mild sore throat after the workout. Do you have any idea what could be causing this? Do you believe that it might be Lyme related? Do you have any advice on how to fix this issue? Thanks for another incredible webinar. You're welcome. Thanks, Duke. So there is a phenomenon in chronic Lyme and chronic infection conditions, and also that happens in chronic fatigue syndrome and in fibromyalgia. And the condition is called neuromediated fatigue. And typically what happens is when you have these conditions, if you exercise hard, and that for these conditions could be, walking a block when you haven't been doing anything at all. Okay. So, but if you do something more than your body can tolerate, it's going to release a bunch of neurologic chemicals that can then give you a lot of fatigue and body pain that typically occurs the next day. Okay. So neuromediated fatigue usually does have a fatigue component and sometimes more achiness with it. I haven't seen a neuromediated related exercise condition that leads to sore throat. I'm not saying it couldn't happen, but I haven't seen it happen. But I wonder if you're having some kind of a variant of this neuromediated fatigue type situation. When it happens full on and you get really wiped out the next day, the way that we manage it is to limit the amount of activity you do, to find a level you can do that doesn't bring on the condition. And gradually over time, as you get your germs under control, usually it'll go away. Now, I'm not fully sure if that's what's happening with you, but you might have some kind of a variant of that kind of condition. Okay. All right. Good luck to you, dude. Hello, Shauna. Hold on here just a minute. I'm having coffee a little bit too late in the day, but it tastes good. I'm sure I'm going to pay for it later in terms of sleep, but hopefully we'll go okay here. Anyhow, let's see. I think I heard you say to take probiotics once a day, 2 hours away from antibiotics, either before or after. I feel like I have to take it 2 hours after each antibiotic dose based on my assumption that each antibiotic dose will kill good and bad bacteria, so it would negate the probiotics if probiotics are taken before. Where is my thinking of? Okay, Shauna, you actually asked this identical question last week, and the response that I gave is in that webinar. Yeah, all of these questions are in last week's webinar, so I'm not going to take the time to actually re-answer them right now. Go back and look at last week's webinar. You'll find the response there. Okay? All right. Bye-bye. Good luck to you. Hi, Dr. Ross. Thank you for sharing your expertise so generously. Do you recommend any supportive treatment for Lyme with biomat, PEMF, or AMP coil technologies for patients? Do you feel like any one of them works better than others? So all of these, the biomat, the PEMF, and the AMP coil, have varying degrees of success in helping patients, okay? So the biomat, is that it's a mat, and it depends on which one you're using. I think some of these have crystals in them as well too. The PEMF is pulsed electromagnetic frequencies, and an AMP coil, I believe, is going to be running various frequencies. I mean, other than saying, without knowing specifically what you're using, I guess the best thing I would say is I give any one of these about a 40% chance of helping a person. I don't think that any one of them necessarily has a chance of helping you more than any other one does. I just give them a try and see if it makes a difference. They're going to be more useful for symptoms rather than actually getting your germs under control, though. Okay? All right. Good luck to you, Heidi. Hello, Sarah. Hi, Dr. Ross. How do you feel about IVIG treatment for of SFM? I think you mean small fiber neuropathy. Presumably, my small fiber neuropathy is caused by my Lyme, Babesia, or Bartonella, although it could be mold too. I have tested positive for all above. How do I get a script for IVIG or subcutaneous IG? Sarah. All right. So everybody, IVIG stands for intravenous immunoglobulins, and it's literally giving you antibodies that are IVIG is literally pooled antibodies that are brought together by taking blood from multiple blood donors and pulling out their immunoglobulins. All right, immunoglobulins are antibodies. Okay. And while these blood products are screened for things like HIV, hepatitis, etc., keep in mind there is always the risk that some unknown infection that they don't screen for gets through. Like, I don't believe they screen these things for Lyme, for instance, okay? So when you take blood products from somebody else, and that's where you're getting this stuff from, you subject yourself to possibly getting other infections. So we need to be careful about who we use these things in, okay? Now, where you have approval and scientific evidence showing benefit to use IVIG is in small fiber neuropathy. Okay, so small fibers, basically, these are the nerves near the skin. They're not the big nerves that come out of your back, not the branching nerves under your arms, but actually the nerves that divide into other nerves that divide into other nerves and get so small that there's just these small fibers, okay? IVIG has benefit for that kind of condition. But to have insurance pay for it, because the stuff is really expensive, you have to have evidence of having the small fiber neuropathy. And the evidence is gained by doing a skin biopsy, sending it off to the pathologist, who then studies it and looks to see, is there evidence on their exam of the small fiber neuropathy. That's how you get it covered. Other people will use IVIG as a possible thing that can help immune imbalance in Lyme disease, but I got to tell you, it's a mixed bag as to whether it makes a difference or not. And insurance companies don't pay generally for it to be used in Lyme disease because there's no real scientific evidence showing that it's beneficial, okay? And again, keep in mind, you have to be cautious using this stuff because it's possibly infected with other viruses, et cetera, that they don't test for, okay? All right. So how do you go about getting it? Well, get a skin biopsy. And if you have a neurologist you're working with and they did the skin biopsy and it shows it, then they would try to get it arranged, and they would argue with your insurance company to get it covered. Okay, that's how you end up getting it done. Okay, all right. Good luck to you, Sarah. Hello, Dave. What's hello, Dr. Ross? I have been on well call for almost 4 months, treating for mold toxicity, trichosethine, gliotoxins, zearalenone, and don't really feel any better than before starting the binder. At which point do you recommend switching binders, and which binder would you recommend? Also, should I retest with real-time prior to switching binders to see if my levels have dropped? I wonder if perhaps I might have yeast overgrowth from all the years using antibiotics, hence preventing me from improving. So there's a lot of things in this question. Let me try to unpack it for you. So everyone with mold toxicity means that you is a condition that happens in 25% of all people, whether you have Lyme, don't have Lyme, can happen in people that don't have tick-borne illnesses. And there's some evidence that says that 25% of us are genetically predisposed to having this problem. What happens in the 75% of people is we breathe in a mold toxin. Some of our white blood cells will see those mold toxins as they work their way into the bloodstream, and they will tag them. Other white blood cells will come in and break them down. That's what's supposed to happen, okay? But in 25% of people, their immune cells are programmed in a way genetically that they don't tag these toxins. And the toxins that don't get tagged then go to the liver. The liver is your next line of defense. And the liver is supposed to break these toxins down and turn them into a water-soluble toxin. But the liver is not able to do that with mold toxins. So they go to the liver as a fat-soluble, fat-based toxin. They come out as a fat-based toxin. They get moved through the gallbladder, out through the bile system, into the intestines. And in the intestines, in a fat-based form, they get reabsorbed back into your bloodstream. So you just get this endless loop. And these mold toxins inflame you. They trigger cytokine excess, okay? So the way that we treat these is to bind them using a binder out in the intestines. The prescription binder that can handle a lot of different toxins, it is this cholestyramine, but it doesn't always work, and it has a side effect of having a lot of constipation problems. Another binder product that might work as well and tends not to have all the constipation side effects is an herbal product that would have a number of different things in it to handle all of these different toxins, okay? So there's two similar products you could use. You could use either something called GI Detox, which is made by a company called Biobotanical Research. That's G.I. So G period, I period, and then detox is a separate word, plus the plus sign, by Biobotanical Research. Or Research Nutritionals has a very similar product, and their product is called Mycopul, Mycopul. And the key components in all these is clay. There is some activated charcoal. There is some humic and fulvic acid, and there is some silica in these. So it's a broad-based binder, basically, all right? And generally, I'll try to work people up to 1 pill twice a day, maybe even up to 2 pills twice a day on that. So a different binder would be that, okay? Now, if you're not feeling better, you have to wonder two things. Number one, is there another problem besides mold toxicity? Yes, yeast overgrowth could be another problem. Yeast overgrowth also triggers cytokines, okay? So conditions that look the same because they all trigger cytokine excess are tick-borne infections, yeast overgrowth, and mold toxicity. And SIBO sometimes, small intestine bacterial overgrowth, can sometimes present a similar way. They all trigger too many cytokines, okay? So you're correct in thinking, is there something else going on? Could it be yeast? Yeah, that's a possibility. Another thing that could be happening is that your binder is not effectively pulling the toxins out, so you haven't had any improvement for that reason. One way to figure that out at 4 months could be to go back and repeat your real-time test and see, have you had any decrease in your toxin levels, okay? A third reason you could not be getting better is even if the binder is working correctly, sometimes people actually continue to have mold toxin exposures from their environment. So everything you pull out is being replaced by other mold toxins in your environment. So make sure, I advise my patients, if they're not having improvements, to get a home inspection done to make sure you don't have mold toxins sitting in your home. And if you work extensively in another environment, that environment needs to be inspected as well too. You need to make sure you're not being exposed. Another reason that you might still have high toxin levels, even if you've been binding, besides the binder not working, besides the environment possibly still exposing you, is there's a small subset of people that when they walk through that building with mold, they got colonized with mold spores that live in the mucus of the nose passages and the intestines. And from there, they start producing mold toxins in you. All right. You're your own mold toxin brew pub in a sense. All right. And so you could be not having dropping levels from that. But the first step is check to make sure that, do your real-time test at this point and see, okay? I would probably do that even before switching your binder. The other thing is, and then if you see no changes, then I would consider a binder change. And if you were my patient, I might consider putting you on some mold killers for the colonization. And what I would do for the intestinal mold, I would put you on something called itraconazole. It's 100 milligrams, 2 pills, 1 time a day. That all gets into your bloodstream and can work up and take care of some of the sinuses. But in addition, for the sinuses, I usually have people do a nystatin or an itraconazole nose spray a couple times a day to treat the sinuses as well too, okay? And then also, I agree with you, you should look and see if you have too many intestinal yeast. Signs that you might have intestinal yeast overgrowth are increased sugar cravings, gassiness and bloating, feeling worse after you have some simple sugars. So things like cookie, candy, cake, ice cream feel a lot worse. That you feed yeast, you'll feel worse afterwards, okay? Having increased pimples or acne goes with too many yeast in the intestines. And how those are related is those yeast in the intestines release toxins that get absorbed into your bloodstream and interact with the skin, leading to pimples and acne as well too. Okay, so those are some things to consider too. All right. So good luck to you. That's a lot of stuff to have to deal with. It gets complicated. It's a complicated issue to deal with. Okay. All right. Good luck to you. All right, so for those of you that are new to some of these things that I was just talking about, all right, so I'm going to do a quick screen share here again, okay? So for information about mold toxicity and how to detox from mold toxicity, take a look at my detoxification section here, and then look at this article called Mold and Lyme Toxin Illness, where I talk about this condition, how you diagnose it, what you do about it, okay? All right, then in terms of trying to figure out if you have yeast, take a look at an article I have here called A Silent Problem, Is It Yeast? And there's also a questionnaire in here that if you score high enough on the questionnaire, is highly suggestive that you might have too many intestinal yeast. And then if you do, then take a look at this article over here called Kills and Prevents Yeast, a Brief Guide, okay? And then finally, in terms of how do you, these 2 binders that I just mentioned to you, let's see. So one of those is this Research Nutritionals product called Mycopole, okay? And the other product is this product called GI Detox Plus, okay? They're very similar products, basically, all right? By the way, so I'm just showing you what the products are. This is my supplement site for my patients, but for anyone can purchase from here as well too. So you can use this site a couple ways. You can use it to purchase things, but you can also look to see what products do I recommend for curcumin, for instance. So I know I mentioned curcumin quite a bit. You can just come up here and type in curcumin, and you could see a number of products I have here that have curcumin in it. The curcumin pure on the Mariva 500, my favorite would be the Mariva 500 for that. Okay, all right. Hello, Dave. Maybe a different Dave, maybe the same Dave. What supplements do you recommend to boost energy levels? I'm very fatigued while in treatment. Any recommendations would be greatly appreciated. Okay. So when it comes to fatigue, there are a number of things to think about. So number one, you want to make sure you're getting enough sleep. And even if that means you need to use supplements or prescriptions, try to get 7 to 9 hours of sleep. Also, arrange your life so you can get 7 to 9 hours of sleep. So if you're a person that burns the candle from both ends, stop burning it from both ends. Set aside time to get sleep and do good sleep hygiene, like turn your computers off and don't bring them to bed. Don't bring your cell phone to bed, okay? Keep your bedroom for sleep and for sexual activity, and stop doing other activities in there. Also, set a common time of the night where you try to fall asleep each night, okay? Don't do caffeine. Don't do this in the afternoon, okay? And keep in mind, alcohol, although it may make you sleepy at first, it actually disrupts your sleep. So if you're having a hard time sleeping, pull the alcohol out and don't have it around bedtime. Don't have it in the evening at all. You may even just consider stopping it altogether, okay? But then if you have to use medicines or herbs, do that, okay? So number one, get sleep. Number two, lower the cytokines. Again, as I mentioned earlier tonight, the key symptoms you have in Lyme disease are all cytokine caused and cytokine related. Those cytokines give fatigue directly. In addition, the cytokines can interfere with your hormone systems, like your adrenals and your thyroid, okay? So as part of how to improve your energy, get sleep, second thing, lower cytokines. Again, the main agent I like to lower cytokines is the curcumin that is in that product called Mariva 500 by Thorne. It's a 500 milligram pill. I would do one pill 3 times a day. They are in the process, by the way, of changing the brand name of that. They're going to soon be calling it curcumin phytosome. My supplier still has the old label, but you may start seeing it if you're looking at other sources. Thorne's product is going to be soon called curcumin phytosome. Okay. All right. Same stuff. They just came up with a different name and slapped a different label on it, but it's the same identical product. Okay. All right. Number 3, support your adrenals and thyroid. Okay. And what I like to use to do that, because that can give you energy too, is to use an herbal medicine called ashwagandha. Ashwagandha has been used for thousands of years in Chinese medicine and in East Indian Ayurvedic medicine because it's been observed to give people more energy. Okay. And my favorite experiment as I was reading about ashwagandha was the one involving mice. The mice swimming pool experiments, where mice that are given ashwagandha swim longer and farther than mice that don't have ashwagandha. All right. So in my mind's eye, I had visions of these mice standing on the pool deck with their little goggles on, diving and racing against each other. But probably that's not how they did the experiments. But ashwagandha can be helpful. It's a 400 milligram pill. I use a product by Organic India. And the way that you do it is you do 2 pills in the morning and 2 pills between 1 and 2. If you take it too late in the day, sometimes it can keep you awake at night. Animal studies show that it actually increases your cortisol levels and increases the efficiency of your thyroid. Okay. All right. All right. So get sleep, lower cytokines, do ashwagandha. 4th thing, be on a good multivitamin. The one I recommend these days is one by physician called Physicians Daily. I would do 2 pills 1 time a day. That's by Research Nutritionals. Okay. Now, if you're doing all that and you still have low energy, then it may be time to think about fixing and repairing injury to your cell energy factories, which are called mitochondria. Okay. So every one of our cells has an energy system called mitochondria. And there's 300 to 400 per cell. Inside the mitochondria is where sugar and fat are taken and they're burned through a bunch of chemical reactions to create a cell energy chemical called ATP. Now, what happens in chronic infections is the oxidation states in the body created by your immune system, these oxidizing agents, can damage the covering of the mitochondria. And if it gets damaged, it can't carry the fuel supply of sugar and fat to the inside well enough. So your mitochondria are energy starved, okay? And second, or fuel starved, I should say. And then secondly, that healthy membrane is needed to donate electrons into some of the energy reactions in the mitochondria as well, too, okay? So if you've got sleep, you've lowered cytokines, you're on ashwagandha, you're on a multivitamin, you're treating your germs, and you still feel fatigued, then the next step is start looking at repairing your mitochondria. And to do that, a minimal step would be to be on a product, something that repairs the covering. The product I like for that is called ATP 360 by Research Nutritionals, and you would take 3 pills 1 time a day. It has all of these fats that make up the covering, and in it are a bunch of micronutrients that help your mitochondria work better too, okay? Now, the only person that should not do ATP 360 is the person that is using either atovaquone, which is called Mepron, or atovaquone with proquinol, which is a product called Malarone, to treat their Babesia. Anything with atovaquone will not work well if you're on coenzyme Q10. And there's a little bit of CoQ10 that is found in the ATP 360, okay? So if that's you, then instead of doing ATP 360, there's another product you can use by Research Nutritionals that does not have the CoQ10 in it, and that's a product called NT Factor. That is also made up of these fats, and you would take that as 2 pills 3 times a day. You do that for a couple months, and then after a couple months, you decrease it down to 1 pill 3 times a day. Okay. Now, if you choose to do the mitochondria repair with either the ATP 360 or the NT Factor, you got to give it at least a couple months to see if it's going to make a difference for you. Okay. If it does, you want to keep going an additional 4 months of treatment on those. Okay. All right. Good luck to you, Dave. All right, so I have a similar article to what I just talked about with Dave. And let me see here. If you look at my chapter called Energy and Fatigue, and take a look at this article called Fix Fatigue and Boost Energy, the Basic Steps. All right, so as I said, get sleep, and I give you some herbal options and some prescription options. That's a good point. Diet. Be on a diet that provides energy, good energy, and that would be a paleo type diet. I talk about that here. Number 3, lower your cytokines. Number 4, be on ashwagandha, which can help your hormone systems work better. Be on a good multivitamin. Treat your infections, okay? And then I say here at 6 months and beyond, if you're not doing better with those steps, then consider fixing your mitochondria, okay? All right. Hello, L. Hold on here a minute, guys. I got to look at one thing here. Okay. And then I'm going to take one other sip of my coffee here. All right, so let's see. It happens on and off that my body suddenly gets very sweaty. My heart feels weak with palpitations. I have to lay down because it feels like I might pass out. It passes after about 15 minutes or so. Do tick-borne infections do this? I had a tick bite 9 years ago, which is treated with 10 days of doxy. I'm fatigued like crazy. On a different note, which at-home ECG devices give accurate readings? I'm trying to find one that is reasonably priced and reliable. thinks we need more docs like you. Thank you. So I haven't reviewed the at-home EKG devices. I don't know. I can't give you a specific comment on that. So these symptoms that you're having of your palpitations, very sweaty, is something that fits into a category called POTS, which stands for paroxysmal orthostatic tachycardic syndrome. All right, that's a big mouthful. Another way of looking at it is you have some imbalance in the function of your adrenaline and anti-adrenaline. The nerve that controls the release of adrenaline, anti-adrenaline, is a nerve that comes off of the back of the brain here called the vagal nerve. So, so it could be due to vagal nerve dysfunction. All right. Now, vagal nerve dysfunction can be part of the infection called Babesia, which is an infection that can get transmitted with a tick bite, not just Lyme, but Babesia can be transmitted, okay? Or the Lyme itself, Lyme infection itself, can infect the vagal nerve, giving you symptoms like this as well too, okay? And 10 days of doxy probably is not enough to prevent any of this from happening. So it is possible, based on what you've written here, that you may have, especially with that fatigue you're having too, that you may have active chronic Lyme through its effect on the vagal nerve causing these kinds of symptoms, or you have a Babesia through its effect on the vagal nerve causing these kinds of symptoms, okay? So symptoms that make me think of Babesia, the big ones are having extensive night sweats, having a lot of temperature instability. I call that hot colds instability, or hot 1 minute, cold the next minute. Having a lot of headaches in the front of the head. Having a lot of lightheadedness when you stand up. Having periods where your heart races all of a sudden on its own and skips around. And sometimes having a bunch of little cherry red spots on your skin, little broken blood vessels on your skin, can be part of Babesia, okay? Also, sometimes people with Babesia, with these adrenaline surges that they sometimes get with this, will have panic attacks. And sometimes people will have a lot of what's called air hunger, a feeling like you can't get air from time to time, okay? Typically, when this is caused by Lyme, you tend not to get all of the air hunger with it. But when you do, and it's caused by Babesia, you can get air hunger with it, okay? I don't have it in this forum. I can't ask you a bunch of different questions with a give and take to help figure out which germs you might have based on symptoms. But briefly, from what you wrote here, there is a strong possibility you might have active Lyme, and you might have or have active Babesia. And so I would consider trying to get in contact with an ILADS doctor that is a member of the International Lyme-Associated Disease Society at ilads.org. There on their contact page, there is a section on their contact form. You can request the names of people that are ILADS members near you, okay? Now, keep in mind, everyone from ILADS doesn't work identical to how I work, okay? But they could at least help you look at, do you have these illnesses, okay? All right. Good luck to you. Hello, Gemma. Let's see. Hi, Dr. Ross. I'm currently taking rifampicin, clarithromycin, and cefuroxime, and I'm unsure the best times to take them due to differing opinion. Some doctors say take them together on a full stomach. Others say take the rifampicin separate to others on an empty stomach. Which do you find best for your patients? Also, which biofilm cyst buster would you recommend to sensitive patients, those that hurts terribly? I thought Japanese Knotweed may be a gentler one, but it blew my head off. Thank you for all you do. Much love from the UK. Well, much love back to you there too, Gemma. And thank you for your comments here too. So in terms of So it is true that rifampin, rifampicin, which is also known as rifampin, is better absorbed on an empty stomach. Okay, that is true. All right. Now, when some people take it, though, if they get a lot of nausea or they have upset stomach from taking it, I will have them take it with food. But I do try to have people take it by itself without food, and usually without other antibiotics, although if they can't schedule it any other way, I'll have them take it with the antibiotics at the same time. It's the food that's going to be the biggest problem, though, in terms of decreasing absorption of it. Okay? All right. Now, in terms of the Japanese knotweed, so I want to let you know the Japanese knotweed, here's how I would classify Japanese knotweed and what it does. So Japanese knotweed, everyone, is an herbal medicine. And it has, based on newer research out of Johns Hopkins University that looked at some of the functionality of it, it has the ability to treat growing Lyme and also persister Lyme. It has the ability to treat growing and persister Bartonella too. I would not necessarily call it a biofilm cyst buster. Okay, all right. So let me clarify my terms here. Okay, all right. So the Lyme germ and Bartonella have growing phase, and then there's a small amount that go into hibernation. We call those persisters. Okay. The Lyme germ, in addition, has different appearances that it looks like. Okay. So the Lyme germ has these forms that look like a corkscrew. We call those spirochetes. The Lyme germ also can lose its covering and move inside of cells and live inside of cells. And we call that the L form. And then the third form of the Lyme germ is these spirochetes can morph into these microscopic balls called cyst. Okay. So those are the forms of the germ. Spirochetes, cyst, and L forms are the forms. Now, based on lab experiments, we know that the spirochetes and the cyst can be in a growing state or they can be in a hibernating persister state. Okay. The L form, no one's done the experiments to be able to look inside a cell and tell us whether they have persisters. We do know that they grow inside cells. I'm just not sure whether they persist inside cells in a persister state. Okay. All right. The Japanese knotweed can cause a significant Herxheimer reaction because it's killing the germs. If I've got somebody that has severe reaction like that to knotweed or to other herbal antibiotics we use, I try to find a dose they can tolerate. So some people, although typically Japanese knotweed, I might want to work to 30 drops twice a day on that. At times, I can only get a person to 1 drop twice a day. And if somebody Herx is bad on that, I might even start at a 1/4 drop once a day. All right. How do you create a 1/4 drop? Well, the way you create a 1/4 drop is you take 1 drop when you put it in 4 ounces of water. All right. And then you just let it sit there. And then each time you take it, you stir it up and you pour off an ounce, and that ounce has a 1/4 drop in it. Okay. So you just got to start really low and slow with it, basically. Okay. All right. There you go. I think I answered your questions. Good luck to you, Gemma. Hello, Astrid. Hi, Dr. Ross. How do you know when you finish with Lyme treatment? My LMD treats patients on average 12 to 15 months by pulsing antibiotics. I have been doing this and taking herbs for 4 months, and I am feeling pretty darn good, although not 100% yet. I don't want to take antibiotics for another year if I don't have to. Do I base the decision to go off the antibiotics entirely on how I feel? Yeah. It's a good question. So the answer is yes, but I want to say more about that. Okay. So I do understand that there are a number of my colleagues that feel compelled to go back and retest you again to kind of give them some idea about whether you're done or not. Okay. And what I have to say is those are doctors that don't fully understand this illness. This illness creates an immune reaction that can come and go even when your germs are gone. All right. So for instance, if we rely on Western blot or immunoblot findings, those measure levels of antibodies. Those antibodies, if they're gone, some doctors, if they go back and repeat the Western blot or immunoblot looks normal, they're like, all those antibodies are gone, your germ must be gone. Okay. There's a problem with that. Number one, the Lyme germ can hide in the body where the immune system may not see it. And secondly, when the Lyme germ is really active, it releases chemicals that can suppress the immune system. All right, so having no antibodies does not prove the germ isn't there. And having lots of antibodies could be a reaction that your immune system has because it was making lots of antibodies to get over your germs and it still is prepared, okay? So we don't really have an adequate way to look and see, are you done with treatment from testing? Other tests that some of my colleagues will do is they'll do these ELISpot tests or T-cell activation tests, either by Armin Lab or Infecto Lab. And the problem with that, the idea is behind that is we pull your white blood cells, a group of white blood cells out of your blood called T white blood cells, and we put them in a test tube. And then to the test tube, we add proteins from the germ that we're trying to see if you still have. And then we measure whether those white blood cells release cytokines. In theory, T white blood cells that circulate in your blood only live for 2 months. And so if these T white blood cells release excessive cytokines, in theory, it means that they have seen that germ in you sometime in the last 2 months, and therefore you could argue that the germ is still there. Okay. The problem is there also are what are known as T memory cells that can circulate sometimes in the blood, but not all the time. And they would release the cytokines as well too, causing a positive reaction. Okay. In addition, if the test is negative, it could just be that your immune system is suppressed by having active germs. And so having a negative reaction test, T-cell reactivity test, doesn't prove the germ is gone either. Okay, all right. So there isn't a good way. So the best we can do is to look at your symptoms. And my guide, what I do is I try to do one of two things. Number one, I try to treat somebody until they're 100% well for at least 2 months, or I will treat them until they're well for at least 4 months. And no matter what I do to tweak how they're doing, whether that means mitochondria repair, whether that means doing things to get rid of biofilms, whether that means using peptides to repair damage from what's happening to them. If we do all those things and they've been at a plateau for at least 4 months, I will consider stopping in those kind of situations as well too. Okay. All right. So yeah, anyhow, unfortunately, Esther, that's the answer I have for you. I wish we had a done test. We just don't. Okay. All right. Good luck to you. Hello, Kate. Let's see. How can we know that probiotics aren't going into the small intestine and causing SIBO? Yeah, it's an interesting question. So when small intestine bacteria overgrowth, everyone, is what SIBO stands for. So small intestine bacteria overgrowth. And what that means is that bacteria are living in your small intestines that aren't supposed to be there, because generally there aren't bacteria living in your small intestines. Bacteria live in your large intestines, okay? All right. Now, what's interesting is there's a debate about should we use probiotics to treat SIBO? And generally what most experts believe is that even in SIBO, that these probiotics do not populate the small intestines, but rather they do move into the large intestines to help it work better, okay? And so the way you gauge it in some of your treating SIBO is you can use probiotics, but if it makes them worse in terms of their symptoms, then stop it. Okay. But if it seems to help, then continue it. Okay. Do these actually populate the small intestines, Probably not. They probably mostly move their way downstream into the large intestines, okay? But the only thing when we're treating SIBO, I will use probiotics for my SIBO treatments, but I tell people if they make you worse is we add them in, and I try to add them in a way that we can tell whether it is a time it so that we can tell that the only thing we're adding is the probiotics. And if a person gets worse, then I have to stop it, basically. The other key when you're trying to use probiotics as part of a SIBO treatment is to use ones that don't have a lot of prebiotic fiber in them or have things like inulin in them. So, and the product I like for that is a product that's made by research nutritionals called Corebiotic Sensitive because it has no prebiotic in it. It's the prebiotic that often will give a lot of gassiness and bloating, okay? So if you are sensitive to probiotics, consider trying Corebiotic Sensitive and doing 2 pills 1 time a day on that, okay? All right. Good luck to you. All right. So everyone, do a quick screen share here. So SIBO, as I said, again, stands for small intestine bacteria overgrowth. Small intestine bacteria overgrowth also can be a syndrome that produces too many cytokines, all right? So I'm going to, if the symptoms that suggest small intestine bacteria overgrowth basically include a lot of gassiness and bloating right after you eat, okay? If you're wondering what more about this condition, here's a whole article I wrote about it. I talk about the various symptoms that happen in it. And then I talk about how do you go about diagnosing it, and then how do you wind up treating it down here, okay? Hello, Kate. Let's see. Do bull's eyes from Lyme get white when you press on them like other pink rashes? Thank you. You know, honestly, I don't know. I honestly don't know whether they do or not. I haven't seen that described anywhere. When I see bullseye described, it's usually with pictures that tell you what its appearance is, but I don't know whether they blanch or don't blanch, unfortunately. I'll have to look that up, Kate. I don't know. All right. Thanks for the question. Hello, Lynn. Let's see here. Hi, Dr. Ross. My child has been taking quercetin and luteolin to deal with inflammation and mast cell activation. It was working well, but then he started having a lot of anxiety and agitation. Apparently, people who are COMT positive, MAOA positive, have a hard time processing quercetin and luteolin and end up with dopamine or norepinephrine buildup. Are you familiar with this, and are you aware of any mast cell stabilizers that inhibit more than just histamine that might be a good alternative? So I'm familiar with these issues. I wouldn't call myself the biggest expert on them, but I'm sorry, the COMT and the MAOA+++. I'm aware of it. I wouldn't consider myself the biggest expert on it. I do a lot in terms of managing mast cell activation as part of my Lyme, so I consider myself expert on that. Boy, if you can't do the quercetin or the luteolin, I don't have other herbal options. You're really looking more at prescription options to manage the condition. Okay, now what both quercetin and luteolin do is they stabilize a type of cell that the mast cells. Mast cells are where histamines are made, and they stabilize them so they don't produce or release the histamines as easily. There are prescriptions that also stabilize the mast cells, and the mast cell stabilizer in prescription medicine is something called cromolyn. Now we can give cromolyn either in an oral form, which affects the mast cells in your gut, not necessarily, it doesn't get absorbed and go throughout the whole body and affect it. So, but you can quiet down some of the mast cell GI activity that can sometimes happen. And for the nose, you can do cromolyn nose sprays, okay? But again, the cromolyn pills and the cromolyn nose sprays just affect the nasal passages and just affect the gut. They don't go systemic. All right. So the other things you have to do if you can't do a quercetin luteolin would be you can still do things to block your histamine. So you can do antihistamines like Zyrtec, Claritin. You can do H1 and H2 blockers. So in addition to your Claritin and your Zyrtec, you could do things like I'm blanking. These are typically stomach antacids that sometimes can help with this as well. The other thing you do is decrease the inflammation triggered by the mast cell activation. That would be to use things like Singulair, which can decrease a lot of that inflammation as well too. Okay. All right. Good luck to you, Lynn. All right, I'm going to just do a quick screen share here. So everyone, there is this condition called mast cell activation. Mast cells are the cells that are your allergy cells. And we now know that in addition to things we're allergic to turning them on, infections turn them on too. So part of treating mast cell activation is getting the thing that's triggering your mast cells under control, which is basically Lyme and bacteria. Could be mold toxins, maybe yeast. In addition, the biggest trigger of your mast cells is anxiety. So doing stress reduction and dealing with anxiety can make a big difference. And then dealing with other things that turn them on, like if you have mold toxicity, getting the molds out, treating your infections, etc. Okay. And then in terms of the symptoms you get, here's a list of the kind of symptoms you might get with it. And then I talk with you about how you diagnose it down here and how you treat it. In terms of the blockers I was talking about, the antihistamines, those are called H2 blockers. The stomach ones are Tagamet, Zantac, Prilosec, and Pepcid are options you could use, in addition to the standard antihistamines, which are H1 blockers like Benadryl, Zyrtec, Allegra, and Claritin. Okay, all right. All right. Good luck to you. Good luck to your daughter. Hello, LLC. Does Babesia get blurry vision? Also, Quest and LabCorp have a Lyme antibodies blood test. They say they use an immunoblot technology. It is a very affordable price. As I don't have insurance, is it reliable? Here's the link. So, in terms of the in terms of Babesia causing blurry vision, the answer is not usually. I don't see that. I see it more with Bartonella. I see it more with Lyme. Okay. And then in terms of this immunoblot, I suspect it's not a good one, but I'm going to take a look at this. Let me do a screen share. We'll go look at the test page together here. Okay, so this is the link that you had in your note. All right, so okay. All right, so this immunoblot is also another way to call a Western blot that they would be using. Let me go back here. Okay, so immunoblot is a term that also can sometimes mean Western blot. And what happens in this test technique, what we do in a Western blot immunoblot, is we grow Lyme germs in the lab and we kill them, and then we take their proteins from their covering. Okay, this lab that you would want to go, that you're looking at, they're using a test kit that has been approved by the FDA for resale using interpretation guidelines by the Centers for Disease Control. And their technique uses only one strain of Lyme germs. That was the original strain of Lyme from the East Coast in the 70s. All right. So it's an outdated germ. All right. And the way that they do their technique will find Lyme, if it is there, about 65% of the time, but it's going to miss it 35% of the time. And it may have false positives on top of it too. Okay. A better way, which is a more expensive way, is the immunoblot method that is used by IVIG. And in their immunoblot method, what they do is they look to see if you have antibodies against proteins from 8 different kinds of Lyme germs. Okay, it's a bigger fingerprint. And the 8 strains include European strains that now have invaded our East Coast. All right, so those would be things like Borrelia afzelii, Borrelia guarinii. We're starting to see those a lot more. The test from that is using these FDA-approved test kits doesn't pick those up as well. Okay. The other thing that the IVIG does with this immunoblot is they're not growing and killing the germs in the lab, but what they've done is they've programmed bacteria in the lab to produce these proteins. And they modified these proteins so that they will not give you false positive tests. Specifically, a lot of these proteins that are found in the Lyme germs are similar to some proteins found on various viruses like the monovirus and something called human herpes virus type 6, for instance, okay? And what we're doing with these tests, we're trying to see if you have antibodies that attach to the proteins. One way to ensure that the antibodies that attach to the proteins were made against Lyme and not a virus falsely attaching to these Lyme proteins is to clean up the proteins so we remove any of the pieces that would attract a virus antibody, okay? All right. So the reason the immunoblot is better from IVIG is it tests against 8 strains, not the original East Coast strain from the 70s that's way out of date, and because the way they clean up these proteins, you're not going to get false positive tests. Okay. All right. So if you want to use a test that gives you a 65% chance of finding Lyme if you have it, go ahead. But it's going to miss it 35% of the time. Okay. All right. Good luck to you. Hello, Mary. Hi, Dr. Ross. Thank you for all you do for us. You're welcome. I know yeast symptoms are similar to Lyme, but can it also cause air hunger, weakness, and elevated liver enzymes? Interesting. So I have never seen yeast lead to elevated liver enzymes. Okay. I have seen Lyme do it sometimes. It's not common, but Lyme can sometimes. But if you have elevated liver enzymes, they as part of looking for causes, they should also be looking for chronic hepatitis C virus infections, chronic hepatitis B virus infections. They should be looking to see if there's something that's not Lyme related that caused that instead of assuming it's Lyme, for instance. Okay. All right. All right. And then in terms of can yeast give you weakness? Yeah, because yeast triggers cytokines. Cytokines can give you weakness. Can yeast give you air hunger? Yeah, but here's how they do it. So too many yeast in your intestines trigger your white blood cells to be reactive in the intestines too. And keep in mind that 60 to 70% of your body's white blood cells, immune system, lines the intestinal tract, okay? So these white blood cells, including your mast cells, will see these yeast and will react against them allergically. And those mast cells will just release a bunch of histamines that get into your bloodstream, go up into your lungs, and can cause reactive airway disease or asthma-like reaction in your air pipes. All right. So I've seen patients that came to see me that had lifelong histories of asthma, that when we took care of treating their intestinal yeast overgrowth, they no longer had to treat their asthma anymore. It can be that profound, okay? So it could be the air hunger is more of a reactive airway asthma-like reaction triggered by yeast in the intestines as well too, okay? All right. Good luck to you. Hello, Leslie. Hi, Dr. Ross. Thank you so much for these webinars. Oh, here we go. I found the second part to your question. Hold on a minute. My question is this. Do you ever see patients whose symptoms come and go? The fatigue is present every day, but my other symptoms, severe weakness, tremors, rapid heartbeat, are intermittent. Thank you. Yes. So Lyme disease, Lyme infection, not so I want to be clear, the Borrelia Lyme infection. Generic, we call Lyme disease this manifestation of things that happens from having tick-borne infections, of which the Lyme germ, Borrelia, usually is part of it, but sometimes people also get Bartonella infections, Babesia. So some people, when they use the word Lyme disease, they really mean any one of these infections, okay? But the Lyme germ, Borrelia, has, as part of the illness, can have symptoms that come and go. It's a very common thing with the Lyme infection. Okay, so yes, and it can be all intermittent. It is possible. Often it means that your immune system is doing a pretty good job keeping it under control, but can't quite keep it all the way under control. Okay, all right. Good luck to you. Hello, Shelby. Let's see. Any suggestions for anemia or low blood volume from these infections? I feel like I am breaking down more red blood cells than creating. Thanks. So just so fatigued. So the question I have, and I can't tell from how you ask this, is do you think you have anemia or do you have laboratory evidence that you have anemia? Okay. So keep in mind, although anemia can give you a lot of fatigue, it doesn't mean that everyone has anemia that's fatigued. If you do have anemia, your doctors should, laboratory anemia, your doctors should be trying to figure out what that's coming from. And they should do, one of the things we can always do is look at your CBC, your blood count. And the first thing we look at in somebody that has anemia is we look at a marker in there called MCV. MCV stands for mean corpuscular volume. It's the size of your red blood cells, okay? If you have small red blood cells, that sometimes is seen in iron deficiency anemia. And if you have that, your doctors should be measuring iron or something called ferritin levels. But if you have large red blood cells, that would be an increased MCV, then we should be looking at whether you have what your folate levels are and your vitamin B12 levels are. Because if you have low folate or low B12, you'll have large red blood cells, okay? And then they should be able to tell from that CBC whether you have signs that you are breaking down or hemolyzing your red blood cells. And if there are signs, then they should be having your pathologist at the hospital look at that under a microscope to give them some clues as what's happening, okay? If you are having breakdown of your red blood cells with laboratory findings, not because you feel that way, but laboratory findings of that, then you have to wonder about Babesia, because Babesia can lead to red blood cell destruction, okay? So beyond that, it'd be hard for me to figure out how to answer this because I need to know more what you mean specifically, and I can't tell from this question, okay? All right, good luck to you, Shelby. Hello, John. Let's see. Hi, Dr. Ross. Can you completely get rid and cured from mold toxicity? If you're one of the unlucky few that have that genetic defect, do you always have to worry about entering a moldy building? If so, how long is exposure necessary to reinfect you again? In other words, does it take being in a building for 15 minutes or 1 hour for someone to breathe enough spores to get sick again? Okay. So, John, if you have that defect, yes, there is the possibility you could get exposures again and get sick again. It's possible, okay? But it's not the spores that you're breathing back in. It's actually the mold toxins, which is a gas that you're breathing back in again, okay? Now, what do you do about this? Well, There are some of my patients that when they get completely over mold toxicity, I have a conversation with them about what do you want to do? So one of the things that I have people can do is you could keep staying on a binder one time a day, like half a scoop of cholestyramine or one GI detox. You take it daily to keep up with any mold toxins that come in, to bind them up so that you don't become toxin overloaded again. Okay, that's one option. I have another patient of mine that is one of the first people I really treated with mold toxicity that was extremely sad, bedbound, seizing daily, stopped breathing from her seizures, had severe pain that even narcotics would not touch. I mean, severely ill, okay? She also had Lyme too. We cleared the Lyme and she still remains sick, and we finally figured out it was mold toxicity, cholestyramine for about 6 months, and she got 100% well. What she does at this point in her life is that she has a sense when she starts feeling mold toxic again. She starts feeling fatigue, achy. And what she does is for about a month then, she'll go back on cholestyramine again. All right. So what her plan is to wait until she starts having symptoms and then go back on it again. And for her, it's maybe about once a year, once every 2 years, she winds up using cholestyramine this way. Okay. But yeah, you may need to do something to keep up with what's coming in at you from the environment. You can do that on an as needed basis, like my one patient does every 1 to 2 years, or you could just take a small amount each day to prevent. Okay. All right. Good luck to you, John. Hello, Penny. Say hello, Dr. Russ. Does Lyme disease cause pain throughout your body, particularly your joints? Your blood work comes back negative toward arthritis. Is it a flare-up or a rain fraction that could be causing it? Thank you. So Lyme disease, the major symptoms of Lyme, the big ones are fatigue, brain fog. By brain fog, I mean you have a hard time thinking. You have poor memory. Okay. Muscle and joint pains that can come and go. All right. And then those are the big ones. Okay. Fatigue, brain dysfunction, body pain that can be muscle or joints. That's what I meant by 4. So muscle pain or joint pain. So yeah, Lyme can do that. Okay. Yeah. I'm not understanding the rest of your question here. So, but anyhow, to answer part of your question, that's what I would say. Okay, good luck to you. So, Penny, let me point you to an article. So, in my see if I can get this to work. So in my online Lyme guide, there is a section called How to Diagnose. All right. And there's this article called How to Diagnose Chronic Lyme Disease More Than a Test. Take a look here. I talk about what do you do to diagnose Lyme. Okay. I review the symptoms, testing, and one of the things to even see if it's a possibility you might want to do that I mentioned in this video article is something called the Horowitz MSID questionnaire. I mentioned it in here. Fill it out and see if you score high enough to indicate that you might have Lyme. Okay. Hello, Carter. What likes to hang out at the base of the neck, and is there anything topically that can chase the infection from a specific spot? No, there isn't anything topically that chases it from a specific spot. People that have a lot of cracking, crinkling, neck pain, often that's part of Lyme. But any of these infections can give you a lot of pain in the neck area. But if you've got that cracking, popping sensation, we tend to see that with Lyme. Okay. Hello, Charlene. Let's see. Hi, Dr. Ross. A few weeks ago, I asked a question, but had many long questions before mine. feeling very tired, and I went to bed early. I understand that. I'm sorry to have to ask again. Do you know of anything that I could take that would get into the bloodline where I have tubes bigger than the bloodline with biofilm in it? This causes high blood pressure, and I have been on 2 statins for 8 months and had a month of debilitating pain and stopped statins. The pain left just sore where it was from the intense pain. Thank Topi so much. I hope you are having fun with your boat. Oh, it's not a boat. It's a camper van, by the way. But it's kind of like a boat. Anyhow, let me see if I'm having a hard time understanding what you're asking here. Just a minute, Charlene. Charlene, I'm not sure how to answer this question. I would have to ask a number of clarifying questions to figure out what you're trying to ask here. I can't tell. I'm sorry about that. So I don't know how to answer this question. All right. Good luck to you, Charlene. All right, everyone. That is it for me tonight. I've got to get the wild Basenjis, my 2 dogs, out to outside Seattle to a kennel that I'm taking them to. It's out in the country. They get to run free and party for the next few days. They're going to dog camp. And I got to get out there before it gets too dark. Because that's what I'm going to do next here. I'm heading actually to Boston tomorrow for a 3-day conference on peptides. And so I may have more insights for you about peptide therapies after I come back from this. Okay. So I do plan on, once I get the dogs dropped off and get back into Seattle tonight, I will be doing my edit on the video, and we'll be creating a synopsis and hope to have that out to you tomorrow morning between 9 and 9:30 a.m. In that email I send out, look for a link to sign up for next week's webinar. And so that we'll do next week, and then that will be on Thursday again. I know I'm on Wednesday here tonight. The reason I'm on Wednesday is I'm traveling tomorrow to my conference, but we will be back on Thursday next week. Okay? All right. Good night, everyone. I had a good time being with you tonight, and hope to see you again here next week.